Good afternoon, my fellow Coloradans. Thank you for joining us today. I'm excited to welcome Jill Ryan, the Director of the Department of Public Health and Environment today. We'll be providing an update on the dial. But first, I'd like to share an update on where we are with COVID-19 today, right now in Colorado. Today, we've reported 1,863 new cases. That's more than the last few days. Thankfully, we also have more testing, so we think we're getting a better sense of the actual numbers. This is the first day that we've been over 40,000 tests in some time, 41,091 tests. So when we see a number like 1,863, significantly higher than the last few days, we're grateful that we have better surveillance because we had over 40,000 tests. I hope that we're able to keep those numbers up. If you have any symptoms or think you might be exposed, testing couldn't be easier, free, quick, and easy across the state. COVID19.colorado.gov. Click on testing sites. It's really important for you that you know, so that if you need medical attention, you can get the right medical attention, but also so you can alert your friends and family and others that might be exposed sooner rather than later to stop the chain of contagion early. We have currently lost, and we remember and we celebrate the lives of 5,454 Coloradans who have died from COVID in the last year. And we know that each one of them is a brother or sister, a friend, a parent, an aunt or uncle, a son or daughter. And my heart goes out to every family who's felt that loss during this pandemic. Overall, we're seeing continued stable trends in COVID-19 in Colorado. Some parts of our state in the high country continue to experience higher case counts. The case counts are trending lower in other areas. I'm also glad to say that we have surpassed 500,000 doses of the vaccine. We've, as of this morning, delivered 514,408 first doses of the vaccine, 179,360 second doses. We're also very proud that over 250,000 Coloradans aged 70 and up have gotten at least their first dose of the vaccine, 64% of the way towards our goal of vaccinating 70% of everybody 70 and up by the end of February. 251,469 Coloradans aged 70 and up have been vaccinated and are on the clock towards protection. Starting on Monday, Coloradans 65 to 69 are also eligible to receive the vaccine. We know that there are still people 70 and up that wanting to be vaccinated. In fact, very likely many of those doses over the next few weeks will still be helping to finish off everybody who wants it over age 70. But we, of course, are excited that people age 65 will begin being able to get it. Please be patient. It might be, just because people 65 and up can get it starting Monday does not mean, sadly, that everybody who's 66 years old can get it on Monday. It will take through February to make sure that everybody age 65 to 69 can receive the vaccine. And you will get it in February if you are 65 to 69. For more information on how to receive on where you can receive the vaccine, go to www.covidvaccine.org. You can also contact your hospital provider. It could be CU Health or Kaiser or SCL, Centura. And of course, you can check with your local pharmacy as well. Many pharmacies have the vaccine, not all of them, of course, but some of them do. And they will be able to administer it to people 65 and up starting Monday based on appointments, currently age 70 and up. Throughout the pandemic, we've used the latest data to drive decisions about how best to save lives, slow the spread of COVID-19, keep our economy open. And with each new phase of the pandemic, we learn more, and these efforts look a little bit different. Our priority of saving lives, preventing a breach of our hospital system is paramount. And thus far, Colorado has successfully avoided a breach of our hospital capacity. Other states have not been as fortunate, but thanks in part to the dial, but largely to your own personal choices that you make in your lives, wearing masks, avoiding gatherings, keeping a distance. We have not exceeded our hospital capacity in Colorado. We want to make sure in the final months of the pandemic that we don't have the worst months of the pandemic and that we avoid breaching our hospital capacity in Colorado. As more vaccines are making their way into arms across the state, particularly frontline healthcare workers and people over 70, soon over people over 65, that will also decrease pressure on hospitalizations. People over age 70 represent about 40%, just over 40% of all the hospitalizations to COVID in the state. But just as each county is a different place when it comes to where we're at, each of us also needs to do our part to reduce the spread of the virus, to better balance the challenges of our economic growth and prosperity, disease suppression, and based on what we've learned over many months of this virus, we're releasing an updated Dial 2.0. It's a more responsive tool that will allow counties to swiftly move up or down based on their needs, desires. This means that when disease transmission is low, there's ample hospital capacity. We can sustain a lot greater degree of ability to engage in closer to normal interactions in the final months of the pandemic. And conversely, when counties see a spike, they need to get on it quickly. Pitkin County was sadly the highest county in the state, case count over 2,000 people per 100,000 a few weeks ago. They then took themselves the step of moving into red, and they brought that case count down by over 70% in just a 2-week period. So these models really matter. The way the counties react really matters and makes a tangible difference on saving lives. While this update of the Dial is a major update, it is also the first update that ties in the Dial to vaccines successfully distributed. Jill will explain how this works, but there's one piece of this that triggers when 70% of the population 70 and up has received their first vaccination, which we expect to be in the next few weeks to achieve that goal. Further, there will likely be one additional update to the Dial in the next couple of months that will also directly tie in where we are with vaccination before we abolish the Dial. I wake up every morning saying, can we abolish the Dial yet? The truth is we all know we can't, but that day will come. There's likely to be one more update that goes further to tie it into percentage of folks in different demographics that are vaccinated. But this takes that first step with a tie-in built into this around percent successfully vaccinated and additional capacity that can be done in a reasonably safe way. Now, to discuss the specific changes, and by the way, we had over 1,500 comments. I read through most of them myself. I think Jill read through all of them. We were excited to see the enthusiasm and support from the health community, the business community, local government about this update for the Dial based on the learning of the last few months. And with that, I'll turn it over to CDPHE Director Jill Ryan. Jill?
Good afternoon, everyone. Thank you, Governor. So I'm going to show you a slide deck. And we will start with the actual Dial framework. Of course, this standardizes the levels of openness or restrictions on a county level based on the metrics of disease transmission, the level of local testing, and hospitalizations. It's a tool that really allows Colorado to tailor our response on a county level, recognizing that conditions will vary locally. Next slide, please. Here's a summary of the changes. The greatest change is in the threshold for disease incidence levels, which were increased for all colors. Most counties have been in level red or level orange restrictions for many weeks, and this will allow more counties to operate in level yellow. Coloradans had made great sacrifices in reducing the level of disease transmissions from our peak in November, and while this is still a time for caution, these metrics better reflect where we are in the pandemic today, what we've learned over the last several months in using the Dial, and the balance we are trying to strike between disease suppression and economic hardships that restrictions can cause. And I will show maps of counties and their current level on the Dial and where they will be in tomorrow after the public health order goes into effect tomorrow at 9 a.m. In just a couple of slides. But as the governor mentioned, because caution is still a priority, counties in yellow that have a 5-star business, and these are counties as of 9 a.m. tomorrow, who have a 5-star business program, will only be allowed to operate in blue once 70% of 70-year-olds in the state are vaccinated with at least one dose. We expect that to happen around the end of February. Next slide. So this is the current county levels where counties formally sit in the dial. You can see a lot of them are in orange level restrictions. Red and orange are, these are a high level of restrictions. And again, just based on where we are in the pandemic, we feel like we can adjust the dial. With the new incidence levels, this is what the new map looks like. Next slide. You'll see that we do have a lot more counties that are in yellow or blue. I do want to caution that these are preliminary numbers, and that simply means that my staff is spending the day just double checking to make sure that the metrics that we're using for each county are correct. So this is how we expect the map to look in case there's any data anomalies in a county or two. Right now, I'm not expecting that, but it certainly could happen. Next slide. So continuing with a summary of additional changes, Dial 2.0 uses a 7-day instead of a 14-day metric for disease incidence, level of community testing, which we call percent positivity, and hospitalizations. This will allow for a swifter ability to move between colors. So whether this is moving to a more restrictive level on the dial or a less restrictive level, it will be more swift. Next, having a high level of community testing that is available and used, measured as a percentage of positive tests or percent positivity, remains vital to helping identify those with COVID-19, because some people have asymptomatic experiences with COVID-19. So we want to be able to detect them through testing, not only so they can seek care early if they need it, but also because we want to facilitate isolation, contact tracing, and quarantine, which are effective disease containment strategies. So we will be having tighter metrics on the level of community testing, measured as percent positivity, for levels yellow and level orange. Ideally, the percent positivity metric should be no more than 5% of all COVID-19 tests, 5% positive. This is the World Health Organization standards. We recognize that 5% becomes harder to meet as community disease transmission increases. So the more restrictive levels on the dial reflect this. The percent positivity metrics are tighter on Dial 2.0 in levels yellow and orange, making it harder for counties to move from red to orange or orange to yellow without sufficient testing occurring. And then also, we will be providing consideration of additional metrics for counties under 30,000 population due to the variability in rates. So we will probably additionally look at things like case counts, number of hospitalizations, because rates can vary when you have a smaller population and that metric isn't as meaningful. Mitigation plans will not be required before moving counties into a more restrictive level on the dial. This will really facilitate a more swift move. Our older practice was to wait until a county hit the next metric on the dial and get a mitigation plan and allow several weeks to try and turn transmission rates around. We found out in October, November that just made the dial more sluggish, that we didn't see by the time somebody or a county was in the next level on the dial, we really didn't have a lot of luck with mitigation plans. And it was more successful just to move the county to the next level of restrictions. So mitigation plans are, of course, highly encouraged, and particularly as counties start to see increasing disease transmission before they hit that next metric. But once they hit that metric and we verify the metric, we'll be moving counties when they have increased disease transmission and also when they have a decrease in disease transmission. Wanted to note that there are just a few changes to capacity levels or caps, most notably in yellow. Restaurants, and that's left off the slide, but it is restaurants can have up to 50% or 150 persons using a space calculator. And this is a change from the 100-person cap. And then, as I mentioned, this will be effective tomorrow morning at 9 a.m. Next slide, please. This is a spreadsheet that just shows the new Dial 2.0 metrics, including the new incidence levels and the changes in yellow and orange on percent testing positivity. Next slide. The governor mentioned our stakeholder efforts. We've met with several groups to discuss changes to the dial, including local public health agencies, county commissioners, mayors, and city managers. We also asked Coloradans for feedback via public web form. And as the governor mentioned, we've had more than 1,000 people reply, and we've read all of those and incorporated those into what is being presented today. Next slide. I did just want to show that some of the reasons for moving the incidence rates up on the dial and making counties being in less restrictive levels not only have to do with where we are in the pandemic today and vaccinations and our learnings over the last few months, but really our epidemiological trends. So this is case counts. You can see that we have had a real sustained decline since November. The bumps in the trends represent the small bump we saw at Thanksgiving, the small bump we saw over Christmas and New Year's, and then a continued decline. So it's obvious that people are continuing to maintain social distancing and mask wearing, and businesses are following the dial level of restrictions, and Coloradans have just been very successful. We've consistently been in the top lowest 10 states in the nation for the last several weeks on disease transmission. Next slide. Of course, hospitalizations correspond with a decrease in disease transmissions. We hit our peak in number of patients hospitalized at 1,847 back in December. We've come down significantly to 502 as we sit here today. Back in December, the state did have to start moving patients between some hospitals as hospitals began to reach their capacity. We also had to help hospitals with staffing and staffing contracts as their staff were sick or they needed more staff to meet demand. And we're a long way from that today. Next slide. And then I mentioned percent positivity. That's a metric we look at for counties, but certainly we track it at the state level. The blue line represents our percent positivity as a state. And for the last couple weeks, we've been at or below 5%. As I mentioned, that's the standard we want to see. And as the governor mentioned, if you look at the gray bars, those are the number of tests that are administered per day. At our high point, we were over 60,000 tests administered per day. And recently, we're back over 40,000, which helped with the decrease in our percent positivity.
If I can just real quickly add on that, the number of tests administered today is based on demand. We have capacity for up to 200,000 tests a day. There's not that level of demand, but we hope that it's, we love to see it 60, 70, 80,000. The more the better, because then you're picking up cases that can reduce transmission. So again, if you're experiencing any colds or flu-like symptoms, or you think you might have been exposed, it's super easy. Get tested. Back to you, Jill.
Thank you, Governor. Great points. Next slide. So the governor did give an update on vaccinations. We all know that this is a game changer and will, shortly start to disrupt disease transmission on a large scale. This just simply shows 514,408 first doses administered, 179,360 second doses administered, and then 469,000 first doses administered to Coloradans, over 70%, and we are 64% closer to meeting our goal of vaccinating 70% of 70-year-olds by the end of the month. Next slide. The next two slides show how counties will be moved between levels. It's a swifter, simpler process to move to a less restrictive level. A county must meet all the metrics of the less restricted level for 1 week. And then CDPHE will confirm the metrics. And if a county wants to move, they simply need to communicate that to us, and we will move them to the less restrictive level. And then the next slide shows how we will move counties to a more restrictive level. And we have found that disease incidence is really the leading indicator, and that's the indicator we want to watch for moving counties to a more restrictive level. And a county can be moved to a more restrictive level based on disease incidence alone. So once the metric for the new levels reach, the county will be notified. We will confirm the metrics, and then we'll move the county swiftly into that level. But additionally, if there is a lack of sufficient testing in the community, because if there's not enough testing, and again, we measure that through percent positivity of tests, that means that the incidence rate isn't accurate, and we can't really rely on that to know the disease transmission level in the community. So that could be a reason that we move a county. Also, if the regional or state hospital capacity starts to feel pressure, or if the state has low incidence because of low testing, but they have a high rate of county hospitalizations of residents, that could also be another reason. But most of the time, it's simply going to be based on disease transmission. And what we've discovered so far is that for the most part, counties do have a sufficient amount of testing. And it's really a matter of people continuing to use the testing, even as vaccine is out there, particularly for those who have not been vaccinated yet. Next slide. That's my last slide. Thank you very much.
Thank you, Jill. And Jill will be available for questions, as will I. And thank you, Jill, and the entire team who contributed to this dial update to over 1,500 Coloradans who provided comments. Thank you for your work. And as I always say, for Coloradans who are watching this, you don't need to focus on the complexities of the dial. All the stuff we just talked about is probably only 20 to 30% of disease transmission. Most of it is the way we behave as individuals, the choices we make. That's the big mover of numbers. So wear a mask, avoid socializing with people outside of your home whenever possible, keep a distance of 6 feet. Just that is working, will work. We just need to keep it up a couple more months here as the vaccinations take hold. This is relatively minor compared to the importance of our individual behavior. And Colorado is moving in the right direction, but that would easily change if we stop wearing masks and start getting together in large groups. It'll change in a moment. There's a very high prevalence of COVID in the entire country and in Colorado, and it'll jump right back up and reverse our gains the minute we let up here. So let's keep it up. There's light on the in the horizon. Every day, more and more Coloradans are being vaccinated. It's so exciting. I visited 6 vaccination sites. I'll be visiting more soon. It's wonderful to see when people 70 up are getting that first shot. Now some are even getting their second shot. The difference it makes to know that they're only weeks away from being able to see their grandkids and go out and enjoy restaurants and life again. Even for seniors in senior living facilities, poker night, movie nights, all those wonderful social things that make life worth living will soon be back. So let's keep it up, Colorado. And with that, happy to go to questions.
Hello, Governor Polis and Director Ryan. This is Vinny Del Giudice at Bloomberg News in Denver. How do you plan to resolve potential dispute between counties and the state on dial moves? And I have a follow-up today as well.
Yeah, I mean, these are clear objective criteria. There shouldn't be disputes. If there's a dispute on the numbers, CDPHE and the county health department would work on it. Sometimes somebody might have entered something wrong, but that hasn't happened that often. I think there's clear direction. And frankly, we have counties that want to act ahead of getting moved on the dial. We talked about Pitkin, which moved themselves into red. And we hope that counties have a very dynamic response, and they are on the ground, and that they're the best folks to help balance the needs of people to support themselves with the needs to keep people safe.
What is the outlook over the next, let's say, 2 to 3 months on vaccine shipments? And has the new administration in Washington been able to make any substantive changes, or are they still in the planning phase? And thank you very much.
There's been two significant changes since the Biden administration took over. One was they gave us visibility into 3 weeks supply of vaccine, which is so helpful. We had been in a situation where we found out 3 or 4 days before what we would get the next week. Having that 3-week window has allowed us to be able to time the addition of 65 to 69, make sure the teachers and educators can be fit in. We simply wouldn't be able to do that planning without those numbers. They've also increased the quantity of vaccine by 16% each week. And then they started a new program that goes directly to 25 pharmacies in Colorado, which we're very excited about as well. So all good news, but again, we still don't have that visibility into March and April. I think that was the other part of your question. And we look forward to getting more visibility on those numbers, but we don't know anything more than what's been publicly reported about that.
Hi, Governor. Marshall Zellinger at 9 News. With the dial change, businesses can now have 50% capacity. It's fair to say that most of the people that would go out to these businesses are people who have yet to qualify to get a vaccine. And there was a study that got a lot of pub this week that showed 20 to 49-year-olds continuing to cause surges. So what's the level of concern that opening up businesses to a population that haven't been inoculated yet could stall the progress that you've cited to allow businesses to open up?
Well, the spread of the virus in Colorado is going to be a function of people's behavior. And if Coloradans are making the right choices, and that means wearing masks around others, keeping a social distance where possible, avoiding socializing with people outside of your home, the numbers will keep moving the right way. I'll just give an example. You talked about kind of going out to a restaurant or something. A restaurant itself inherently is not a high-risk environment. It's what you do there that can put yourself at greater risk. What does that mean? If you go out with your family, the people you live with, your significant other, 2 people, maybe there's kids, 4 or 5 people, that is a low to low medium risk activity. Now, if you have 8 people from 8 different households all gathering together and having dinner together at a restaurant, that is a higher risk activity. It's not the fact that it's a restaurant. It would be just as high a risk if it was in somebody's home. It's the fact that people from 8 different households are mixing. It's not so much about where they are mixing. So I think that, and we talked about how a lot of 70 and up are gaining protection, already 250,000 first shot, 100,000 second shot. As that group gains more confidence, I think you'll see more customers returning to theaters and stores and restaurants who are 70 and up once they have that level of protection. But you're right, protection is still a distance away for people in their 20s. Precautions when they go out in terms of limiting the number of people that you're socializing with. If it's a couple, if it's a small sort of bubble of folks, but the freewheeling type of association, if that occurred, would certainly lead to another spike. And what we've seen before from every spike is that when it starts with the 20s and 30s, it rapidly moves up because we don't live in intergenerational isolation in our society. People of all ages interact.
Hello, Governor. Bill Folsom at News 5 down in Colorado Springs. First, thanks to you and Joe for those graphics today. Very helpful. Got a question about the back and forth going on between CDPHE and El Paso County about equity of distribution. Are we looking into that? Some are saying that Denver's getting more in that. And part 2, can there be more transparency with where vaccines are going? Everybody has to do a public core request to even see where those vaccines are going. So kind of 2 parts there. Are we looking into that equity? And can we make it more transparent?
Yeah, let me go to Jill first on this. Jill?
Thank you for the question. And I want to let you know that we are working on a dashboard, and the dashboard will show several metrics. It will show the number of vaccines that have been distributed to a county and also the percentage of county residents that have been vaccinated, since some residents, of course, go over county lines to receive their vaccine. We are talking to El Paso County. We do realize that there's been a discrepancy in allocation, and my understanding that my staff is working to make up that discrepancy. And they're really doing the best they can to try to be fair between the counties. At the same time, some of the larger hospital systems are able to vaccinate folks very quickly, and they draw from a multitude of counties. We think that's where potentially some of the equity issues could come from. And then also in the first couple of weeks, we had Pfizer, which needs the cold chain storage. We didn't have Moderna, so that went to places that had that capability. And so we think for some of the rural counties, that might be where the numbers are off. So we're looking at that very carefully. We are going to have a dashboard to improve and increase transparency, and we're always open to hearing if counties feel like they haven't gotten their fair share, because that's certainly our goal.
And I would just add one other piece to that. Separately, we have the requirement that every dose that we give to somebody is used within 3 days. And so there are providers that haven't met that in different parts of the state, and we will reallocate that dose because the priority is getting it into the arms of a Coloradan. It doesn't do any good sitting on shelves. That's one of the ways we've been able to be one of the leading states in successfully distributing the vaccine. And that is absolutely critical for everybody that we partner with in any part of the state.
Hi, Governor. Chelsea Brensel with KRDO News Channel 13 in Colorado Springs. Bill kind of started off what I was going to ask about, but a question: who sets policies for how vaccines are allocated in Colorado? And is there a possibility that vaccine allocation will change to a population-based model? And if so, when? If not, why?
Well, it is generally a population-based model. They're distributed, but the thing is, hospitals are not universally spread throughout the state. So you might have one hospital that serves a multi-county region in eastern Colorado or in southern Colorado. We try to augment that for counties that don't have a hospital to work with pharmacies in those hospitals. For instance, when the federal government asked us to identify the 25 pharmacies that would directly receive supplies from the federal government, more than half of those are in rural areas to account for the fact that people might have to drive an hour or two to get to the nearest hospital. Did you have a follow-up?
Yes, sir. I just wrote one other thing is your office has said for 2 days that they've had thousands of life-saving vaccines sitting on shelves here in El Paso County. You had just mentioned that they need to use these vaccines within 3 days. If they're not doing that, is there something that's going to happen if we just have thousands sitting here?
Yeah, we would seek to reassign those vaccines to another partner, usually in that same community, who can get them out. It could be a police or fire department. It could be the city of Colorado Springs. It could be the county health department. So it's not an unusual situation. There's been a number of cases around the state where, for whatever reason, they weren't getting administered, and we worked to get those reassigned back out to make sure that they were all used within 3 days.
Thank you.
Hi, Governor. This is Yesenia Robles from Chalkbeat. We're hearing that school district leaders working with providers and local public health are concerned that the 3-week rollout you've described is unrealistic given the supply of vaccine they're seeing, which in some cases has been less than what they are expecting. Do you still think Colorado will be able to vaccinate all school staff within a 3-week period? And if so, what information are you looking at that local public health providers might not be seeing to have that confidence?
Yes, the numbers work. We've checked them and double checked them. We will be able to reach 120,000 folks that are in that category: teachers, private, public, paraprofessionals, school clerks, daycare. Of the 120,000, we know that not everybody will get it, but we model that we expect that teachers, because they're well educated, generally have a higher vaccination rate than the general public. So that's taken into account. And with the quantities we expect to receive, yes, over the next 3 weeks, everybody who meets that category will be vaccinated. Does that mean that some won't be, in the fourth? Some might be in the fourth week because they couldn't schedule it in the third week. Maybe they had a conflict. Maybe they had an unrelated cold and couldn't go in. I'm sure some folks will be getting it, in the fourth week. But essentially, we are prepared as a state to partner with the providers to provide all the vaccine needed for educators over a 3-week period.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. El gobernador anunció que iniciará la vacunación para maestros. ¿Será un requisito para que puedan volver a dar clases en personas? Y si existe suficiente cantidad de vacunas para atender a esta nueva etapa de inmunización en el estado.
Es muy importante para los niños y las familias que todas las maestras pueden regresar seguro a las clases, porque mucha gente tiene dificultades ofrecer la educación en su propia casa. Desde el inicio, el objeto del Estado ha sido enfrentar el proceso de distribuir la vacuna de la manera equitativa, salvar la mayor cantidad de vidas y poner fin a la crisis de salud pública. Los maestros recibirán la vacuna a través de su empleador. El Estado depende del gobierno federal para el suministro de la vacuna y esperamos que la producción continúe aumentando y podamos conseguir más inyecciones y vacunar a más personas. Y recuerde, la vacuna es totalmente gratis por toda la población. Todas las personas de nuestro estado mayor que 65 años pueden recibir la vacuna gratis empezando el próximo lunes.
Good afternoon, Governor. Jason Grenauer with Denver 7. If I'm reading the maps correctly, Denver should move from orange to yellow tomorrow at 9 a.m. Businesses there just started applying for the 5-star program. They won't be able to move to blue unless they hit that 70% of 70 plus vaccinated. So I know that moving the dial might be good for a lot of people, but all of these businesses that just worked on trying to get somewhere now can't. I was just wondering if you could address the 5-star and the businesses with the changing color dial.
Yeah. So what first of all, what customers should know about 5-star businesses is they have go above and beyond safety protocols, inspiring consumer confidence. It's good for any business if it's available in your county to get that certification. It also means that they are the very first to reopen more, the very first that are able to have more capacity. And they will be, of course, under this incarnation of the dial as well. When we hit that 70% of 70 and up in the next week or two or three, those businesses will be able to be at much more normal capacity than businesses that haven't gone through the 5-star program. It also means that if, God forbid, the situation reverses, they will not have to reduce their capacity in the same way businesses that don't have those safety protocols in place have to reduce their capacity.
And just a quick follow-up, if I can, could you just speak to why move the dial now? Why specifically tomorrow, February 6th, was chosen as this is when we can change the metrics?
Well, we always do these things as soon as we can and have the right information. So we put out the draft for comment last weekend. People had several days to comment, 1,500 comments, went through them all, ready to reflect that in this final edition. No reason to sit on it. Doesn't mean anybody has to open. I heard some businesses, why don't we have more notice? Well, you don't have to do anything, right? You can keep your plans or you can expand based on this. Nobody has to do anything. It just allows for businesses that want to have more capacity. And there's no reason at all to sit on that once it's been done. So we do these things in real time. I know that, some folks asked why the draft was put out on Saturday. We almost had it ready Friday night, but then people would have said, why do you put it out Friday at 9 p.m.? So the truth is we work around the clock. Jill does, our team does. When something's ready, we don't sit on it. We get it out.
Governor Chris Vanderveen with 9 News. I have 2 questions. One, hopefully, is going to be super simple at the beginning, and I'll ask it first. So if I'm a restaurant owner in Denver, let's say, and I'm at 25% capacity now, starting at, for the lunch hour crowd tomorrow, they're going to be able to open up 50% capacity. Is it as simple as that?
Yes, that's very simple and very true.
Okay, and the second part of the question is it's in relation to what was asked before, but I want to get more specific about what I keep hearing is a lot of frustration from business owners that feel like they're jumping over a lot of hoops to sort of fill out the paperwork necessary and do the things that they need to do in order to get 5-star certification, that type of thing. And then changes come along and they feel like a lot of that paperwork and time spent was a little bit, their whole effort becomes moot because things change. Can we add some clarification to businesses moving forward that there's not going to be these type of changes that cause them to do paperwork that ends up being moot later on?
So first of all, we hope that all of our businesses embrace COVID safety protocols because they care about their employees and their customers. That fundamentally is the single biggest reason to adopt additional COVID safety protocols consistent with the 5-star program. That being said, we also, with the carrot, want to make sure that those that embrace COVID safety protocols are among the very first to reopen and the very last to have to reduce their capacity. And this dial update is consistent with this. If God forbid the state goes in the wrong direction, they will have additional capacity to serve people based on their COVID protocols. If we continue in the right direction, they will be among the very first to return to increased safety in the next few weeks, increased capacity in the next few weeks. So there is a carrot, but I do hope that the bigger reason to do it is because it's the right thing to do. It's the right thing to do in your business, to do everything you can to be able to protect your employees and your customers from the deadly virus. And I know that so many businesses across the state have really gone above and beyond, and we really wanted a way to recognize that through the 5-star program.
Hi, Governor. Ashley Franco with KKTV 11 News here. I just wanted to hit back on the El Paso County kind of issue that we're having. Your office has sent us several responses saying that 10,000 plus doses are just sitting on shelves for over 7-8 days. Now CDPHE is saying that there was a discrepancy. Who's really at fault here? I know the mayor is kind of upset. And will the state in the future withhold vaccines if they are just sitting on the shelf?
Yeah, and I'm upset too because we want to see every vaccine used within 3 days. So when vaccines, and there have not been vaccines reassigned from El Paso County to other providers recently. There might have been in the past. This particular is more of an alert to use them. They're not being reassigned. If in the future vaccines have to be reassigned, we will seek to keep them in the same community, meaning El Paso County shouldn't worry about those doses going to Denver or Pueblo. But what will occur is we will try to find other providers, and there are many in El Paso County that can successfully get those out. The relatively minor discrepancy in numbers is being fully met. It's just a week-to-week fluctuation. I think it's 2,000 extra doses that El Paso County is getting. But every part of our state still needs to do a better job getting the vaccine out. And absolutely, we are holding all of our partners accountable for using every dose of vaccine that they receive. And that's one of the ways that Colorado has been able to remain in a leadership role in getting the vaccine out.
Thank you.
Hi, this is Claire Cleveland, CPR News. Vaccine rates for Black and Hispanic Coloradans remain disproportionately lower than their white counterparts. Can you just share any evidence that the strategies so far to close the gap are working?
Let me go to Jill first on this. Jill?
Thank you very much for the question, because we absolutely have to be intentional in our efforts to make sure that no one is left behind. So an order from me will be coming out shortly to require providers to ask their patients to fill out the race and ethnicity portion of the vaccination card. The patient doesn't have to do that, but we don't want providers moving so quickly that they're not getting all the information they can. So we want to be sure that we're able to fully capture and count who's getting vaccinated, so we are confident in the data. Beyond that, we do know that there are barriers to getting vaccine for certain groups, particularly people of color who've been hit, particularly hard by COVID-19 in terms of case rates and hospitalizations and deaths. So we're being intentional. We're working with community-based organizations and churches and setting up pop-up clinics around the state where we can offer vaccinators to go to different parts of the state and work to set up 2 clinics if it's a 2-dose vaccine regimen, which right now that's the only choice that we have. We're directing vaccine to pharmacies in what we're calling vaccine deserts, so neighborhoods where there isn't a community-based health center. People might have to travel far to get a vaccine. And we're working with partners like community-based health centers, our local public health agencies who can request additional vaccine from us if they are targeting communities that are underserved and showing us how they're going to do that. So, we think that this will start to bear fruit shortly, but certainly we are tracking it. It is highest priority to myself, to the governor, If it's not making a difference, we'll do something different. But we're hoping, that we are not leaving anyone behind in this pandemic.
Thank you, Jill. Next question.
Hi, Governor. DJ Summers, KDVR. Schools are still the #1 outbreak location type, but the administration is opening schools while other location types with lower outbreak numbers are still restricted. Can you explain why?
Yeah, so the COVID safety protocols around schools are very strong. It's a multi-layered approach with symptom screening, mask wearing, distancing where possible, cohort isolation. And what that means is, in nearly all cases, those outbreaks have been contained at 1 or 2 or 3 kids. Unlike outbreaks at major industrial plants, meatpacking facilities, where it goes to hundreds of people. So we've been, thus far, outbreaks will happen in every part of society because people will have COVID and still at a very high prevalence. But because of the safety measures that exist within schools, including quarantine measures, they've been very effective in keeping those outbreaks very small.
Thank you, Governor.
Hi, Governor. It's Sean Chitness with CBS 4. Just wondering, as you make the vaccine more eligible for other people, specifically those under 70, what do you say to those who are over 70 and still trying to get the vaccine, saying they're struggling to get it from pharmacies, fire stations, or their providers? Is there any way to prioritize them as you open it up to more people?
Yeah, so over 250,000 Coloradans aged 70 and up have received at least the first dose of the vaccine. That places us 64% of our way onto our goal of vaccinating 70% of those 70 and up. What I say to anybody who's 70 and up is you will have the opportunity to receive the vaccine in February. Most of you either have already had it or will have it the next week. But by sheer numbers of what we get, we know that not everybody can get it the same day. And so if you're 70 and up or if you're 65 and up, you might get it tomorrow, you might get it next week, it might be another week, but you will have the opportunity to get that first vaccine in February. And of course, we should very soon be able to expand that to additional groups after everybody who's 65 and up has been able to get the vaccine.
Hi, Governor. Ed Seelover with the Denver Business Journal. I think it's pretty clear what your changes do immediately, but can you talk down the road a little bit? I mean, do you envision things like festivals coming back this summer? How do you envision the Rockies being able to have people? I mean, what do you hope for a couple months down the road by doing this today?
Well, I don't think, Ed, I would just say what we're doing today doesn't really mean anything for what's happening in a few months. Again, it really depends on where we're at with vaccinations. If we were in sports season today, the Rockies would likely have fans in the stadium, probably in a similar way to the way Broncos did. It would be done in a safe way with cohorts. That was actually available during baseball season, but Major League Baseball chose not to have fans in the stadium. I hope that there's enough fans willing to go cheer on the Rockies without Nolan Arenado. But where we are in April is also very likely to be different than where we are in June and July. So it's a long season. And I think as we go through that season and achieve that herd immunity level and get rid of the dial, it'll be much closer to normal fan activity at Rocky Stadium. But I'm confident that there'll be fans in the bleachers opening day. I don't think it'll be at full capacity like an opening day might normally be. But unless we're at a spike of an outbreak like we were in November, I think it's likely that if the Rockies are interested, Major League Baseball is interested, they'd be able to have protocols that could keep people safe to cheer on the team. Ed, was your question more about, I've talked about the Rockies a lot. Were you specific to the Rockies or did you want to know about other things too?
Well, in general, I wanted to know about other things too, like summer festivals. I mean, just these big gatherings that Colorado is known for. Does this set us up to be able to have them again this summer, or is that still unrealistic?
So, a lot of that depends, Ed, on how quickly we can achieve that level of vaccination and herd immunity at that 60 to 70% level that makes this a far less risky threat to our daily lives. And as frustrating as it is, I don't have any additional information beyond what's been publicly reported. And that's why there was a question earlier. It could be May, it could be July. But yes, at some point, of course, the dial will be gone. people might still be cautious, but there won't be any public measures in place to require that. Those who've had the vaccine will probably be able to fully return to everything they want to do, and those who haven't might want to be a little bit more cautious till they get it. But when we reach that 60-70% plus vaccination rate of the general public, it's really not something that we know based on the information that we have today about the flow of vaccine into the state. I would say at the earliest it would be May, at the latest it would be September. I'm hopeful it'll be earlier rather than later. And there will be one more update of the dial before that, as we talked about, with additional ability to have events and festivals based on the fact that we will have at that point already have protected everybody age 65 and up, already have protected people with pre-existing conditions, already have protected key members of the essential workforce. And so that will be built into very likely one more update before we can abolish the dial altogether.
Thank you.
Thank you all so much for joining us. Stay safe, Colorado. The best thing that you can do, wear a mask, avoid socializing with people outside of your home, keep a distance whenever possible, wash your hands. Thank you. God bless America. God bless Colorado.